I still see people logging in, so I think we'll give them just a minute or two just to get a few more people. But as you can see, there's some information if you want to download the app up there, and you'll get a fun animal character assigned to you.
Tell me, can everyone still see it? I just moved it from one of my screens to the other. Okay, great. That way I don't have to have my camera and my presentation on two different screens. So. I'll test that out. Can people hear me speaking over the music? Okay, it's not garbled.
No, it sounds good.
Okay, I'll let it play lightly in the background then.
All right, I think people can continue to kind of log in, but we'll get started so that we have time for questions at the end. Thank you for attending today's seminar. I am Shauna Walbrink, and I am from the Mayo Clinic, and I'm one of the members of the Voices for Children Child Abuse Prevention Council of Olmsted County. Since 1983, April has nationally been recognized as Child Abuse Prevention Month. Child abuse and neglect affects children of every age, gender, race, and income level. Voices for Children is committed to providing learning opportunities for those whom support youth of our community. All of us on the council extend our thanks for attending today's session and how you positively affect the lives of our children and the families in our community. Today's presentation is Neglect and Psychological Maltreatment and will be presented by Dr. Katie Johnson. She is a child abuse pediatrician at the Mayo Clinic Center for Safe and Healthy Children and Adolescents. She completed her medical school and pediatric residency at Mayo Clinic and did her fellowship in child abuse pediatrics at Seattle Children's Hospital and returned to Mayo Clinic in her current position in 2022. She's passionate about interactive education and curriculum development and has created an online game-based curriculum in the child maltreatment that is being submitted for national dissemination. She also serves as an associate program director for the pediatric residency and writes broad preparation questions for the child abuse pediatrics. Social work and nursing CEUs will be provided for today's session. See the chat at the end of the presentation for a link to the certificates, along with a link to a SurveyMonkey to give feedback. We would also like to note that today's presentation is being recorded and will be available on the Voices for Children website on the Family Service Rochester website and will be available for viewing for 1 month. I don't want to take up any more time, so I am going to turn it over to Dr. Johnson.
All right, thank you so much, Shauna. And thank you all for attending today. There will be fun music kind of throughout as we do some of the interactive questions. And I see many of you have already figured out how to join. It is pretty straightforward with the instructions on the screen. But if anyone's seen a presentation by me before, I'm a Kahoot enthusiast. And so you go to either kahoot.it on your phone or your computer, or you can use the app if you happen to have downloaded that or want to. And then you're going to type in this 7-digit code. You can also use the QR code to get there. And then you'll have up to 3 spins of the wheel to choose your anonymous nickname, which is usually an adjective and an animal, and then a picture that has nothing to do with either. And I've recently learned from participants that you can accessorize your participant image too with like rainbow sunglasses or pacifier or whatever you like. It makes also, I think, covering this heavy material a little more of a psychologically safe space. So with that, I will start us up, but people can still join. In fact, I'll put the code 779-7847 into the chat, but it should remain on the screen in the bottom center for those who still want to join. All right. So talking about neglect and psychological maltreatment. Now I've combined these two topics because in creating this curriculum, I realized just how many overlaps there were between them. First, the broad kind of definition and scope and difficulty in creating a universal definition for both, as well as a lot of elements of overlap between them. And I like to start every presentation that I give by giving this disclosure that those of us, I mean, I'm kind of preaching to the choir here, but those of us who do this kind of work day in and day out can start to speak about it pretty matter-of-factly. And I never want to discount that if you're not used to talking about things like this every single day, that can be really emotionally distressing. These cases are difficult to hear about, and those emotions are very normal. And I also think why it's so important to cover content like this. So I encourage everyone to debrief with trusted colleagues and mentors about these types of cases. And I especially like you to know that all of the images and cases used in this presentation have been used with appropriate permission from the hospitals involved. And this is where we'll be going today. It's kind of a coverage of neglect, including its definition and 5 subtypes. And then same for psychological maltreatment, including specifically acts of commission and omission. And then we'll talk about this difficult topic of child torture, which again is another reason that these kind of overlap. It kind of combines the two as well as physical abuse into a common definition. And before that, I'd like to start with a pre-module assessment. And some of these, including potentially this one, I do use for education research. And so all responses are voluntary and anonymous. It's up to you if you would like to participate. And we'll do, in terms of the content, we'll do the same questions at the beginning and at the end. So I'll try not to discuss the answers as we go at the beginning, even though you'll see whether you got it right or wrong, but we will cover the content throughout. I actually have a couple questions first about the audience. So this is a poll. Which of the following best explains your professional role? And I'll get our music up and running. All right, so primarily social workers, some medical providers, and apologies if I missed anyone, but the next question gets at an opportunity to describe yourself better. What is your job title? I also thought this was funny. All right, thank you so much. I always just kind of like to have a sense of who's in the audience. A lot of different specialties and roles represented there, including 3 asterisks. All right, and this is our first kind of content question, getting at confidence. Rate your confidence in defining child neglect, psychological maltreatment, and child torture. 1 to 10. All right, now Kahoot is going to make it look like 5 is the correct answer just because it makes me choose something, but obviously there's no correct answer about how confident you feel. But we've got some answers across the board there. Now we'll do some actual kind of content or knowledge questions. And now the scoreboard will start to show after every question. There's no points for your confidence level, so we're all at 0. All right, neglect accounts for approximately what percentage of child maltreatment reports in the United States? right, so again, you'll see whether or not you got that correct, but we will cover it throughout and again at the end. And now there's points on the board. Rapid Shark in the lead. All right, next question. An unintentional fentanyl ingestion in a toddler represents which of the following subtypes of child neglect? All right, and that one's a little bit of a gimme. Most people did get that one with supervisory. However, part of the point of this question is just thinking about all the different subtypes that there are. All right, Sturdy Wolf in the lead. Two more, I think. So which of the following is an act of omission that constitutes psychological maltreatment? All right, another one, actually, a lot of people get this one by word association, kind of omission, isolating. It's kind of a test-taking skill question. We will cover that as well. All right, some movement there. And last one for the pre-assessment, which of the following is a criterion for diagnosis of child torture? And some people getting that one correct. It was the green one. We'll cover all of that and more. All right, focused emu into the lead. So now I'll jump into cases and content. And these cases, out of all of these modules that I've created, I think these are some of the most distressing cases. They are real cases that we cover. So this is a 7-year-old female who lives with mother and her partner who had an unresponsive episode at home. So 911 was called and she was found to be bradycardic, so that means slow heart rate in the 60s, minimally responsive. She was given fluids, taken to the hospital, and noted to be severely malnourished. And as you can see from her weight curve, she was kind of tracking up, and then sometime in the last few years, not only fell off the growth curve and dropped in percentiles, but dropped in actual weight to lower than she was at, say, the age of 3. And she had extensive skin injuries. So as I've noted here, these are difficult to view photos. I also acknowledge that it's lunchtime too, and these are distressing cases. So if you do need to avert your eyes, they're tough images to see. You can see how emaciated she appears with the prominence, her bony prominences at the knees, at the shoulder blades. We also use the buttocks as a good indicator. You know, obviously that's a place where you should have more gluteal fat. And then you see a lot of skin color changes, which I don't know the reasoning for this, but we do see sometimes this hyperpigmentation with significant malnutrition. And then additionally, you can see what we call scaphoid abdomen, or it's just kind of concave. And then, you know, any one of these bruises or skin injuries might not be specific in itself, but except for, you know, the eyelid and the angle of the jaw, they're pretty significant and larger than you might expect. But the rest of them, it's not any of them alone, but just kind of the constellation of these skin injuries everywhere without explanation. So this is kind of a medical question, but what risk would she be, or what would she be at risk for during nutritional rehabilitation? Let's see how many people know this one. All right. So a lot of good thoughts there. So the correct answer though is refeeding syndrome. And for those that haven't heard of this, it's for a lot of times we talk about it with eating disorders, but anyone who's severely malnourished, who is then nutritionally rehabilitated, so kind of given nutrition again, you have to do it really slowly and steadily, and ideally in a hospital setting, because the electrolytes can shift in the body in ways that are life-threatening. So even though it's a medically focused question, I think knowing that is so important for any one of you who might be on the front lines. You pick up a child like this and they're saying, I'm hungry, and you feel like the worst person ever if you don't give them a snack immediately. But it is important, if possible, to get them to the hospital first for some baseline labs, and then they can be monitored as nutrition is slowly reintroduced for their own safety. All right, Bold Cat is on fire there, and Focused Emu still in the lead. All right, so for this child, she actually had a happy ending in her case. So Child Protective Services was able to locate the patient's father, from whom mother had kept her isolated. She was able to discharge in his care. And just a kind of a personal aside, father was told at, I don't know, 8 or 10 p.m. at night that the next morning there would be what we call an FTDM, or a family team decision meeting, to decide the patient's disposition from the hospital. And at 8 a.m. the next morning, he had 20 people on the phone line in support of him as a father. It was a really beautiful and tear-jerking reunion that they had in the hospital. And he had continued to send photos to the medical as well as the child protection team of how she was plumping up as she regained nutrition, and she looks happy, and she's doing well in his care. So we're glad to hear that. This is a little bit of a breather to do a puzzle question. So there's many subtypes of neglect. Match the cases with the subtypes. So just scroll, click and drag them with your finger into the same order. And biliary atresia is a severe liver condition at birth, for those who don't know. And this is the most sinister of all the Kahoot songs. All right, it looks like most people got those. And really the point of this question is just to think about those different subtypes there. So loaded firearm in the home, kept unlocked, would be one of many examples of kind of supervisory neglect or risk. The second case, the red case, it was actually a consult of Dr. Duraf's several years ago, but family declining a needed surgery, opting to use prayer instead, a life-saving surgery for their child. And then, that concept of homeschooling, but if there's no formal kind of structure or curriculum, is it really homeschooling? Could be educational neglect. We'll talk about all of those and more, but first I have one more case. This was an 11-year-old male adopted from Ethiopia at 8 months of age. He was essentially healthy until age 5, and then he was homeschooled, but without kind of a standard curriculum. He had seen 10 different pediatric subspecialties at this hospital for things like the following: being underweight, stealing food, smearing feces, ravenous hunger, eating until he vomited. So parents, in response to this, had locked up some of the cabinets, restricted his food. And in medical settings, some people were saying, good job. It's good that you're protecting him from that overeating and vomiting. But meanwhile, he was really underweight. And again, kind of a medical spin here, but Prader-Willi syndrome is a genetic condition in which children are usually overweight or obese, and they have this ravenous hunger, and they search, for food, even sometimes needing locks on the cabinets, or they'll eat things out of the garbage can, and they can have behavior issues as well. So that was one thing that was considered on the differential. And again, this is a kind of medically based question, but try your hand at it. So which of the following is more consistent with starvation than Prader-Willi as a cause for this child's hunger? All right, so a little bit of both the red and the yellow. But the children with Prader-Willi can have this like ravenous hunger and food stealing. They might vomit or have also behavioral challenges. There's, I believe, some intellectual differences in these children as well. But it's the weight. It's the weight and BMI that doesn't make sense. He has some of these similar tendencies, but he's incredibly underweight, which is not something we see in Prader-Willi. And I put this question out there to emphasize the fact that sometimes in the medical world, people were able to consider a diagnosis that didn't even make sense with what the child looks like, instead of considering that someone was lying to them. It's also confusing. Why would these parents bring their child into care if they're not feeding him? But I mean, as many of you may be seen, people do this, and it's hard to explain, but it's out there. So we do need to consider that on our differential diagnosis. Focused EMU maintains the lead. For this child, it was an interesting turn of events, actually, where a local teacher at the school where the biological children of the parents still attended kind of took notice of this child and talked to the parents about their experience with adopting, because she was interested in adopting as well. And through that conversation, it came out that they would like to adopt this child out. So the child was adopted by a local teacher, so kind of a second adoption for him. And that's when his disclosures really started to come out. And these are just, I have 2 of the 3 slides I used to have just because of the secondary trauma of these disclosures. I took out the third. But they included being referred to as the N-word by his adoptive father, being whipped and beaten by his parents and siblings, having an item thrown at him that knocked out at least one of his teeth, being malnourished, starved, denied clean water, being locked out of the house as punishment, isolated in his room, made to do all the household chores, left behind when the rest of the family went on vacation, and being made to touch an electric fence while his family laughed. Being locked in a closet, taped to the bed, locked in his room, and having his mouth taped shut. He disclosed being deprived of food, leading him to stealing food from other children at school, from mouse traps, and from the dog bowl. Just an aside, my former medical director used to say there is one reason underweight children steal food out of the trash. One. And that's always stuck with me. So they're not being fed. He was made to drink contaminated water with oil and hot sauce until he vomited, and was forced to make himself vomit at times. He was isolated during school lunches, in which he was only allowed to drink Pediasure per his 504 plan. And 504 plans are like school-based plans that a lot of times, physicians or medical providers have a hand in formulating or signing on to. So this is really scary, right? I can imagine whatever pediatrician signed that was probably wanting him to have Pediasure in addition to what he was also eating to supplement his nutrition, and not that that's the only thing he should be allowed to have at school. In his case, as far as I know, he remains in the care of that teacher who adopted him. Unfortunately, though, the court case against the adoptive parents was dropped. The child, not surprisingly, was having incredible mental health and behavioral challenges and was unable to testify, and the attorney didn't feel that she had a case, a strong enough case without his testimony. And I put the statue, the sculpture of Lady Justice here because I use this case to remind me that although we would like to see, people held accountable for their actions and see this go through court, justice may look different to everyone. And perhaps the best outcome we can hope for is that he remains in the care of someone safe who's getting him the trauma-informed care that he needs. All right, so after those heavy cases, and by the way, I do have the chat up here if people do have questions or comments that they want to submit, but we'll cover the different subtypes of neglect and definitions. And you can kind of think about those cases as we go through. So neglect is the most common type of child maltreatment. It makes up about 3/4 of reports to CPS, most of the deaths related to maltreatment, and can coexist and overlap with a lot of other forms. Sometimes that's surprising to us as doctors because it's not 3/4 of the cases that we see, like the physical and sexual abuse, but I'm sure to the members of child protection in the audience, this is no surprise. It's hard to come up with a universal definition. There's actually one paper that says, is it neglect? It depends on who you ask. And we'll cover that in a moment. But one of the legal definitions that's available is failure of the caregiver to provide needed food, clothing, shelter, medical care, and supervision to the degree that the child's health, safety, and well-being are threatened by harm. So now we'll do a couple of poll questions just to demonstrate kind of the subjectivity of neglect. First one is declining vaccinations neglect. All right, so kind of across the board, most people saying no. I imagine if we had an audience of pediatricians or nurses, we might have more in the middle or upper because it's a common frustration that we face in the medical office. However, in day-to-day conversations, in pediatrics practice, we're not reporting people who decline vaccinations. But I'll talk a little bit more about how sometimes, once a child has a serious sequelae of not having a vaccination, sometimes we look at it through a different lens. I tend to say likely no, because again, we're not making those reports in this clinical scenario. But of the 9, I believe, cases that have gone to higher courts appealing, asking this question, 7 of the 9 have been held up as neglect, which I found really interesting. One more, severe childhood obesity. Is that neglect? All right. So again, across the board, a lot of people saying likely no, but I use these questions just to show that, again, it kind of depends who you ask, because we've got answers all across from yes to no. And there's one great article that talks about malnutrition and neglect. And remember that malnutrition can mean you're really underweight. It can also mean that you're really overweight and you don't have the nutrients that you need. And part of some of the nuances it talks about are, it depends on the imminence of health-related comorbidities. So how severe are the medical complications of the obesity? And for instance, the age of the child. You might think about this question differently for a 3-year-old than a 16-year-old who's maybe making more of their own food-related choices. All right, but with that, we'll talk about the multifactorial, multidimensional nature of neglect. This is my favorite slide, I think, of the whole presentation. And I've drawn these examples from one of our classic child abuse textbooks. But it talks about, on the left-hand side, is it the act of the caregiver, or across the bottom, is it the outcome for the child that we use to assess neglect? Because imagine 2 scenarios. One is a caregiver who's going out, every night to drink or use substances, leaving their sleeping child at home alone, but the baby sleeps soundly and nothing bad happens, compared to maybe the perfectly responsible parent who one time forgets to latch the pool gate and their child stumbles into the pool and has a anoxic brain injury or even dies. So I don't have an answer to this question, but I just like to use it to demonstrate that this can affect how we think about and assess neglect. And vaccines, I think, are one of those scenarios where we in the hospital, maybe we're seeing a child with a meningitis that would have been preventable with a vaccine. We might be more quick to think of that as neglect than the everyday encounter in the office where somebody says, no thank you to vaccines. And then in addition to the multiple dimensions, there are different neglect risk factors relating to the child, the caregiver, the family, and the community. So kind of every level of that child's environment. And neglect can differ depending on culture. We had a resident rotate with us who had spent part of her early years in the UK. And even just between the United States and the UK, she said the expectations for supervision of a child are very different. If anyone has any other kind of cross-cultural anecdotes that they want to share in the chat, feel free as well. All right, so when we talk about neglect, there's various subtypes. Some people say dental as well. I tend to loop that into medical. But we'll talk about each one of these: supervisory, medical, physical, educational, and emotional. All right, so starting with supervisory, this is the most vast and the most common form of neglect, and it's everything from not having adequate substitute childcare to things like drowning, unsafe sleep, head trauma from certain falls, or unintentional gunshot wounds, from guns maybe not stored safely, unintentional ingestions, or this is the category that would capture caregivers who are impaired due to substance use and, unable to respond appropriately in an emergency. I also like to highlight prevention opportunities, particularly in pediatrics clinics, but really that any of us can help impact. Things like anticipatory guidance, hey, your baby's probably going to be rolling about this age, so try not to step away from the changing table. Not that doing so would necessarily be neglect, but just injury prevention. Similar with gun safety and storage, talking about appropriate safety, storing guns and ammunition separately and safes that the child or teen truly does not know the code to. And then advocating for affordable childcare so people don't have to rely on, unsafe secondary care situations. So this is a slider question. Try to take a guess. A child under what age can never be left home alone or unattended? All right. Now I'm going to preface this by saying the true answer is it depends. Before you guys get all over me about maybe different states or opinions there, but it's just kind of a question to get you thinking. We had a variety of different responses there. Focus Emu is still in the lead. So truthfully, the answer is it depends. I'm going to start here at the bottom with depends on the child's development, maturity, feeling of safety, safety of the home, of the neighborhood. But also people like a number and a table. And at one point, something like this was actually published by Health and Human Services. I can't find the original posting anymore. I can only find kind of secondary references to it. But again, I think sometimes people do appreciate some kind of concrete guidelines to get them started. And so it starts with under 7 and under would be never. So that's why it's a child under the age of 8. Whereas 8 to 10 years would be something like an hour and a half during the day, 11 to 12, less than 3 hours during the daytime, 13 to 15, anytime during the day, not overnight, and then 16 to 17, no more than 2 days at a time. Even my sister, when my nephew turned 9, she was asking me, when is it okay to leave a kid home alone? I know you're going to tell me it depends, but like, what's the number? So people appreciate having some sort of concrete starting place. All right, similar question. According to the American Academy of Pediatrics, a child must be how old to babysit? Great. All right, so everything kind of centering there around 12. And just following the chat, I think this is all from Marissa. Thank you. And I'm wondering if this is pulled from the Olmsted County guidance or if that's somewhere else, because I recently discovered that Olmsted County had some nice kind of guidance written up about at least locally. So, all right. So as far as babysitting, American Academy of Pediatrics has said that if you ever see anything by healthychildren.org, that's the American Academy of Pediatrics website, they said, at least 12, or they phrased it young adult 12 to 14. But again, it depends on that child or teenager, on their maturity, trustworthiness, patience, sense of responsibility, ability to handle common emergencies. And on the website, the very last question is, and do you like children? And I'm like, shouldn't that be the first question? But it depends on a lot of different factors. Right, from Minnesota Prairie County Alliance Home Alone Guideline. Thank you. Thanks so much for sharing that, because it can depend a little bit on state statute too. I know we've at least got some people here from Minnesota and some from Wisconsin. All right, so moving on to educational neglect. This is pretty straightforward, but it would be failure to enroll your child in school or provide homeschooling, or enrolling them in needed special education, or allowing or causing truancy. And I don't know if anyone can indicate either in the chat or raising your hand if you've read the book Educated. I found it to be really powerful. I sometimes limit my consumption of work-related media after hours, but as hard as this was to read, I was glad that I read it. It's a memoir by Tara Westover, who grew up kind of off the grid, no medical care, no school attendance, and experienced several different forms of neglect, one of which was educational neglect. And there are a lot of different websites like this one listed here where you can find the different homeschool laws and rules by state. So you can find out if someone wants to homeschool, if they need to notify the school district or use a certain set of curricula, etc. All right, and then physical neglect. So this is things like not providing food, shelter, clothing appropriate for the weather. In the pediatrician's office, it might look like a child who's not gaining weight, faltering growth, someone diluting the formula due to not having resources, child with very, very poor hygiene or not dressed appropriately for the weather. But I always like to emphasize in the bottom right, having limited resources, like just poverty, is not neglect. Our first step, as I'm sure all of you, it's social work, child protection, this is your bread and butter, right? But we should start by assessing those barriers, providing those resources. And then if we're still not getting the children what they need, that's when we are more likely to call it neglect. The homeschool website somebody just asked was, I think, responsiblehomeschooling.org. So some prevention opportunities is to engage you wonderful folks in social work to assess some of those barriers, provide some of those community resources, advocate for programs that alleviate poverty, and a lot of federal programs, actually, this is a burgeoning area of research in our field, have been associated with lower risk of neglect or sometimes physical abuse or foster care placements. All right, so medical neglect. There's a great paper. It's back to 2007, but it's by Carol Jenny, one of the kind of founders of this field and the primary editor of our main textbook. So she and a committee wrote up this paper about medical neglect. And anytime someone consults me about medical neglect, I tend to send it out and say, these are it's 5 criteria, but I've collapsed them into 4 because number 2 is split into 2 separate ones in the write-up. But the first couple are kind of easy for us to answer. Like if we're thinking something's medical neglect, we probably think there's harm without doing this medical thing. We probably think that the benefits outweigh the risks of doing this medical thing, whatever it is. We want to make sure, again, that those barriers are bridged. Does the family have access to the health care? And then lastly, does the caregiver understand the medical advice? And that's the last and the hardest piece. I think especially as medical providers, you can always nudge us to have we been really frank with that family about the short and long-term risks and really honest about the importance of what we're recommending and why we're recommending it? And the paper goes through a whole bunch of steps to consider before calling child protection, like have you used an appropriate interpreter? Have you made a care plan or a medication schedule that would work for the family? Things like transportation or offering telemedicine. Those are all things that we do before we put a stamp of, I think this is medical neglect on there. And that gets to our prevention opportunities. Have we assessed parental health literacy and education? Again, engaged social work and done things like offered transportation to clinic or telemedicine. All right, the last one that I include is emotional neglect, intentionally right next to the psychological maltreatment section, because there's such an overlap there. So this is the least visible, but often with delayed and long-term effects form of neglect. And it could look like anything where the caregiver is unable to provide that nurturing, stimulating environment, unable to provide psychological support to the child, or treating them or their emotions as unimportant, invalid, or excessive. And prevention opportunities from a medical perspective are things like, I usually think of mental health and substance use. How can we connect these people to needed services and ideally without stigma? All right, so moving on from the subtypes of neglect to psychological maltreatment and how this all wraps in to get to child torture. So emotional neglect as well as psychological maltreatment, I think, are particularly tough because if you think about this spectrum, right? When is this just, that's suboptimal parenting? And when is it, that's psychological maltreatment? It exists on a spectrum. And psychological maltreatment is reported in adulthood by about 8 to 9% of females and 4% of males. I'll give just a moment. I usually like to ask people, why do you think that is? So feel free to unmute or type into the chat. Why do you think it's reported in adulthood by more females than males? And while you're thinking about that, I'll just kind of cover on the right. So it can involve acts of omission or commission, can be verbal or nonverbal, active or passive, and with or without intent to harm. Intent is kind of more of a legal term than medical. Now, did anyone have any thoughts about why it's reported by more females? No brave souls. That's okay. Usually when I have this conversation with residents and medical students, we all kind of theorize that it's more often reported by females, but probably equally experienced. But there's some kind of gender norms, exactly, stigma related to cultural values of masculinity in regards to emotion. So it might be kind of more normalized or less recognized among men or boys. All right, so these, and then, yeah, females may be more in touch with their emotions. Males are taught not to feel emotions. Absolutely. Everyone's kind of answering the same vein that just comes up again and again when I talk to people about this. And then I really like kind of charts and visuals that help me understand and categorize things. So this is what I created for psychological maltreatment. There are acts of omission, which are kind of taking away or withholding, and acts of commission that are more actively things the caregiver is doing. And then I put examples on each side. So ignoring the child's extreme pain, for instance, or isolating, locking the child in a closet for hours. Think about those cases that we talked about and some of the overlaps. Neglect itself is one of these. So we will commonly see in the medical world, for instance, caregivers not seeking care for their child's suicidal ideation or not taking it seriously. And then more acts of commission or spurning. That's usually the term that most people don't recognize. That I kind of think of it as verbal abuse. It can be nonverbal, but it's anything that kind of decreases that child's sense of self-worth. So name calling, belittling, terrorizing can be things like threatening to harm the child, threatening to harm yourself in front of the child, threatening to kill or harm, their favorite pet or their favorite toy, like destroying something in front of them that's like their prized possession. And then exploiting or corrupting, probably more straightforward, but this can be commercial sexual exploitation, facilitating the use of illegal substances, or labor trafficking as well. All right, so this is a true or false question. Of all the forms of child abuse, psychological maltreatment is associated with the most adverse outcomes. All right, and people are probably taking context clues, right, that I'm talking and teaching about this. So yes, it actually is, at least according to a couple of the larger reviews that have been done on this topic, and this was one of them, but another one actually just came out. They described that one of the most striking conclusions from this review was the broad association between emotional abuse and or neglect, and I lump those as psychological maltreatment, and adverse outcomes in almost all areas of assessment. So you can see some of those areas of assessment listed right here. And I'm sure this probably rings true with just some of the associations that you see too. In addition to psychological maltreatment, I think is the least often recognized and reported. Part of the reason is, like in the pediatrician's office, we might see a really negative interaction, but it's hard to say, is that their day-to-day? Are they just having kind of the worst day of their life? When is it reportable? It's often out of sight, and it's hard to know when and exactly what to report or what's going to be done with that report. It often overlaps with other forms of maltreatment, but I tend to think that one of the reasons this is so tied into these negative outcomes is that we don't have the same kind of organized response that we do to sexual abuse and physical abuse and specific therapies for that. It comes out later, and it's addressed with kind of adults seeking their own therapy for any of these concerns. All right, so finishing up with the concept of child torture. Now, I was never taught about this in residency. It wasn't until fellowship in child abuse pediatrics that I realized that this was an entity of its own. And so often these cases have repeated CPS reports that may have been unsubstantiated or screened out, because it's really hard to hang your hat on anything. A lot of them are like, there's forced exercise, or they're not being fed, there's starvation, but then, you go and evaluate the house, there's food there. It's just, are they actually being fed that food, et cetera? It can be hard to substantiate, but child torture, the definition was based on initially a case series of 28 patients, and now research has expanded using the same definition. And they characterize it as at least 2 physical assaults or 1 extended assault, at least 2 forms of psychological maltreatment. So remember, we looked at those forms, like spurning, neglecting, et cetera. and neglect. So neglect is the answer to the question. It's always a criterion for diagnosis, resulting in prolonged suffering, permanent disfigurement or dysfunction, or death. And I put these two stories, these two kind of familiar stories on the slide, Harry Potter and Cinderella, because it's amazing as you go through this kind of training and education, how often you see overlaps in just these familiar stories that we grew up with. So this part too, I hope people will unmute or type in the chat, name some features of these two stories that exhibit some of those components of child torture, neglect, psychological maltreatment. I'll give a moment for people to think about that. Isolation, yep, social isolation. So Harry Potter being covered under the stairs, Cinderella, I forgot where she was, but isolated somewhere. Spurning, for sure, name calling, belittling. There is a difference in Harry Potter and how he was treated versus his cousin, kind of the biological child of the parents. And actually, child torture is one area where there is kind of that true stepmother phenomenon. It's more often kind of driven by females as opposed to male perpetrators. And it's often an unrelated person, not always, but the stepmother. Or in one of the cases I showed earlier, the adoptive mother was kind of driving it. There's also, so with regard to Harry Potter, the family had the resources, but he was kind of not dressed appropriately for the weather, unkempt, etc., compared to his cousin. And in Cinderella, this picture is from a scene where her stepmother destroys, her prize necklace, like the one beautiful thing that she owned in front of her. So that's terrorizing. So a lot of different overlaps, allowing truancy. Yep. Trying to keep them out of wizard school, but I think school in general too. All right, and with that, we've made it to the post-module assessment. So we'll do those same 5 questions from the beginning. Rate your confidence in defining child neglect, psychological maltreatment, and child torture. All right, so once again, it's going to look as if 5 is the correct answer. I wish I could change that, but it does look like there's been a shift to the right. So I'm happy to see that perhaps people are feeling more confident in that area. Focused Emu is still rocking it, but Great Macaw has a great answer streak with 3. All right. Neglect accounts for approximately what percentage of child maltreatment reports in the United States? All right, most people getting that correct. It is about 3/4, 75%. That's been pretty consistent year to year. All right, some movement there. Winged rhino into 3rd place. An unintentional fentanyl ingestion in a toddler represents which subtype of child neglect? All right, so most people getting that correct. It's supervisory. Nice symmetry there with one physical or medical neglect. But that would fall under that vast scope of supervisory neglect. All right. Which of the following is an act of omission that constitutes psychological maltreatment? By the way, the speed of answers counts for points too. All right, so most people getting that with isolating, so it's not symmetry, but really all those four having just one. And so that would be on that side of the things that you're taking away or withholding. So neglect, ignoring, isolating. Those are all acts of omission. All right, a little bit of movement. Focused emu holds the lead. Last question. Which of the following is a criterion for diagnosis of child torture? All right, so most people getting that, with neglect being a part of that definition. Of course, you could have pattern bruising, fractures, sexual abuse, malnutrition, but all of those would be elements of kind of the required pieces, with neglect being one of those required criteria. All right, and with that, I'm happy to take any questions, but I would be remiss if I didn't bring you to the scoreboard. So that's the fun part. Go through all these reference slides. All right, winged rhino in third. Sturdy wolf in second. And focus emu. Usually it shows our honorable mentions. With that, feel free to brag in the chat if you're one of the winners, and otherwise I'm happy to take any questions. All right, it looks like the link for the CEUs is there as well. I'll keep this quiet. Oh, thanks, Nikki. Oh, and there's the resource. Thank you for anyone else who wanted that Home Alone brochure from Rissa. Sorry, I can't get the question until I save this document. If anyone can see the question, feel free to read it to me. Let's see. All right, thank you. All right, and my email.
Any questions so far?
Great. Well, that's fine. My email is pretty straightforward. It's johnson.katie@mayo.edu. So if there's any questions that you want to ask one-on-one or things that come up later, feel free to contact me. Thanks everyone for their time and attention.
Thank you so much for presenting.